right, we are live in our Facebook group, Alzheimer's and Dementia Support Group. Hello, hello, hello. If you are watching live, please comment live. And of course, if you're watching on the replay, please comment replay. It was good that I double check because Nikolay and I were just talking already, and then it wasn't streaming live in our Facebook group. That's why we really need to double check. We need to double check, ladies and gentlemen. I guess we are really live, and I just wanted to introduce our guest for today. And bam, there you go. I'm going to stop that music for a minute. I just wanted to introduce our special guest for tonight. Today is what you call our Tuesday Dementia Training, wherein we interview different people, talk about Alzheimer's, talk about dementia, and actually interview different people. And we've been interviewing different therapists and physicians in this group. But today we have a special guest. His name is Nikolay Zuyev. He's actually a registered nurse in Visiting Nurses of America in New York. And he's here today to teach us some stuff about their business, called clinical selfie, on how to actually detect early onset and stuff like that. We may not be able to have the cure right now for Alzheimer's and dementia, but until there's a cure, there's a care, and that's what we're here for. That's what we're here to learn from Nikolay today. So Nikolay, thank you very much for your patience, brother. We were already talking for like several minutes, and I was double checking if we were live, and I just wanted to have some interaction with our audience. So again, please do introduce yourself. I know with some enthusiasm again. I know we're live. I can see it myself now in Facebook. So please tell us
you, Dr. Mike.
What you do and what is clinical selfie?
Okay, thank you so much. Hello, everyone. Thank you for inviting me to this webinar, Mike. My name is Nikolay Zuyev. I'm a registered nurse and biologist from New York City. I've been doing this job for more than 8 years. And I've noticed that the first sign of Alzheimer's disease may be an increasing forgetfulness. Many times as I administered mini-cog test at home, I noticed that seemingly alert and independent patients have a profound cognitive impairment. So in my experience, people are unable to determine independently themselves how bad their memory problems, how bad their memory impairment is without an assessment by a healthcare professional. So that's what we normally do as visiting nurses. We do a bunch of other things, but one of them is a mini-cog test, which is a rapid assessment tool. We tell you 3 words, you remember them, then we draw numbers on the clock, you set hands on the clock, and then you report back 3 words that you remembered, and hence comes the score from 0 to 5. So from there, I got concerned because my grandfather developed alcoholic dementia, and I myself became developing increasing forgetfulness, slightly, thank God, but it was a wake-up call for me. I changed my diet, lost weight, and started to research myself, and noticed that some things that we could notice using just pictures.
So you did had some
with, as well as with any damage to the brain or to. Oh, okay. Yes, I've noticed that with as well as with any damage to the brain or to the eye with Alzheimer's disease, you will not see as well as you used to, especially for color, shape, size, visual closure, and figure ground. Your interpretation will be different than of a healthy eye-brain pathway interpretation. So it took about 2 years to determine what works, what doesn't work, face-to-face assessments, talking to people, asking questions. And now we were actually able, after 2 clinical trials, to deliver the product to judgment of others. It's free. It's the app as well as the link. People can take a quick 15 question test. It's pictures. You just answer you pick a multiple choice and you get a response right away after answering all 15. If there is a correlation between your cognitive state and how would Minicog test you at the moment. So the test, of course, is not perfect. At the moment, the error is at least 15% when we compare it to Minicog, but at least it's more than 50, of course. Specificity is 85%, and rather sensitivity is 85%, which is the correct identification of Alzheimer's in comparison to Minicog, and the specificity, which is the identification of no Alzheimer's in comparison to Minicog, is 79%. So definitely more than 50%, not 100%, but that's what we're striving for, to get an excellent tool, free, safe, reliable, that would help people to see if their forgetfulness has anything to do with Alzheimer's. They should really consider it now, the way, because many people just go undiagnosed until family and friends tell them, but usually it's a little late now.
All right, I think I lost you there for a minute, Nikolay. For those people who are watching live, again, please comment live. If you're watching on the replay, please comment replay. Well, anyway, Nikolay was talking about mini cognitive test. It's basically a quick test that we do in the healthcare professional to identify, not really to diagnose, but to actually rule out different diagnoses. So it doesn't necessarily mean you've got dementia, but it's a good indicator that you are actually decreased, your cognitive function is declining. And that's the goal there. So mini cognitive. And in their clinical selfie, and I know Nikolay mentioned about those numbers, specificity, is it a randomized controlled trial, stuff like that. Us as caregivers, sometimes we don't care about that. But in the healthcare field, it's very significant. We know those numbers. In that way, we could really tell, is this test really effective or not? Because there are a lot of tests that will come out there, and we need to know if it's really effective or not. And that's the goal here, to educate you. Hey, this app here, or this whatever software that we're endorsing, is actually effective. Like what I said, it's not a one and done, diagnosis, but it's a good tool. It's a good tool. Just like in therapy, we have several different tests that we do, like manual muscle testing, like time, get up and go. Sounds fancy, but we want to know their baseline. We want to know their baseline. We want to know where they're at. We want to know where they came from. And we also want to know where they're going to. And if we don't know where we're at, how can we go to the goal? And that's the purpose of their app. That's the purpose of their system, or whatever you call it, clinical selfie. Am I correct, Nikolay? You want to know where your patient is at right now. And you want to know, is he getting worse or getting better? That's the purpose there. And when you have something objective in hand, you can determine, hey, mom is getting worse, mom is getting better, or what should we do? Is it a medical issue? Is it a UTI, urinary tract infection? Is it dehydration that's causing her to decline in her cognition? Or is she getting better because there's more exercise? Is it the medication working? Is there's more blood flow to the brain? That's the purpose of that app that we're talking about today. So again, if you have any questions, ladies and gentlemen, in our training today or tonight, just ask away here in our group, and we'll be happy to answer. So going back to Nikolay. Nikolay, could you tell us more about the app that you're talking about today?
Yes, absolutely, Mike. So basically, right now it's a test. You download the app, or you follow the link and you answer 15 questions. You get the response right away. What the functionality of the app is, since it's out of pocket, we don't receive any sponsorship from anyone. After you get your result, you receive 2 questions a week, which will keep an eye on you on how well you answer exactly the same questions that you answered initially. Like you, Mike, said, will have a baseline for your initial performance or the performance of your patient. And in a few weeks, the patient or yourself will be able to answer at least 10, 15 questions given to you, not as I said, but twice a week, two questions a day. And later again, you can retake the test and compare your scores so that, as you pointed out, Michael, it's going to be an objective score. You're measuring yourself, your personal performance, because everyone is different, but you really want to know how you personally are doing in comparison to
I love
yourself.
how I love how you mentioned about you're comparing yourself, you're scoring yourself according to your performance. Never ever, I mean, even as a human being, ladies and gentlemen, never ever compare yourself to another person. Even in our group, a lot of people will say, "Hey, my dad is taking this medication. Can they take it too?" When we see those posts, we actually delete it. Why? Because one patient's medication it's different, could be different for another patient. You know, the therapy that we provide in my therapy, and when I do therapeutic exercises or therapeutic activities or any kind of training that I do with a patient, it's not the same with another patient that has dementia. It could be the same with a hip replacement. That's the reason why we have protocols. Protocols means you do the same thing again and again in those same type of patient. But with Alzheimer's and dementia, it's different. Every single day, it's different. And if you feel like every day is different, type in different in the chat box. We want to know if this is correct, because it is correct. And that's what I like about what Nikolay said. You don't compare to other. You compare to your score. And that's the reason why you have to have a baseline, like a clinical selfie. Compare to your score. After a day or two, do it again and see if you're getting better. Now, if it's getting worse, if the scores are getting worse, identify what's making it worse. Is it the lack of fluid intake? Is it are they missing their medication? Are they missing their medication? Are they having some congestive heart failure, event wherein they're swelling and they forgot to take their water pill? You have to make sure to identify, and that's the beauty of it. So, am I correct, Nikolai? Am I explaining it right there?
Yes, you're absolutely correct, Dr. Mike. You explained everything well and in detail. You recapped what we were talking about and set another point step for us to discuss, which is actually the test is not tailored really much for some. Well, we don't know who is our user is, to tell you the truth. It may be someone, we thought it may be useful to someone only who needs to check their memory right away for early signs of cognitive impairment, because that's when you want to intervene. But actually, after being in your wonderful group and interacting with members, we saw a lot of enthusiasm from nurses and physical therapists that they like to use it with their patients as well. And as Dr. Mike just said now, it may also be used for caregivers to help them compare performance of their loved ones at home. So it may be used for a variety of purposes. We just don't know who may like it more at the moment, because, as I said, we just started giving this out after 2 years of trials.
Well, big things starts with one small step, and I think you're on the right track. You're in the right group, in the right niche, because we need more innovators like you. We need more people who are actually going to do this. Because first of all, dementia is just getting bigger. People are getting more and more of this disease, not because it's infectious like COVID, but it's actually because people are living longer. And we need people like you who are actually innovating and changing the game, not just being, just being stagnant in the current system. We have to find ways how to serve this audience, because, nobody's going to serve them until we do, so we just have to level up. And I think I like what you're talking about. And of course, you mentioned about other clinicians actually using it, because we need more tools. I need more tools. And that's the beauty of this, is it available in a cell phone app, Nikolai?
Yes, it's available as ALZ test in both Android and Apple App Store. Currently, it only gives you 5 questions, but it's been recalibrated. It should have been ready before we had this webinar for 15 questions, but hopefully, maybe today, later today, tomorrow, it should be ready for 15 questions. You download it and you answer 15 questions, get the response right away. Or a link is available on our Facebook page, on the website, on a couple of posts that I made in our group, in this group.
Oh wow. Oh wow. Well, why did you? I know your grandfather had Alzheimer's or dementia, and what made you really decide to focus on doing this?
Honestly, uh, it's because of me. I became forgetful myself, and I know how crazy it may become, if it's normal or not, if it's getting worse or not, what way it's going. How about others? Is it okay in comparison to other people? So I had to measure it somehow, and this it's just out of creativity, honestly. Then we put it into trials, and after a couple of years, we got some data to back it up. That there is some, positive effect that everyone could derive from using this tool.
Oh wow. Oh wow. Well, you know what? Speaking of forgetfulness, that's me. When I think it
Yeah.
was last year I got fired. Man, I forgot where I parked my
Ay, ay, ay.
car. I'm like, where did I
Ay,
park?
ay, ay.
I mean, I'm considered normal, right? I mean, of course, right now, right? And I was just anxious, and not out of this world. I wasn't paying attention. I forgot my car. Where I parked my car. I forgot my car. I forgot where I parked my car. English is not my first language, Nikolay. So I don't know if you noticed that. And I forgot my car. I forgot where I parked my car in Walmart. And I called my
Wow.
wife and I said, "Well, could you pick me up here at Walmart and let's go out and drive around the parking lot because I don't know where I parked my car." And ladies and gentlemen, if you're watching live, if you've forgotten where you parked your car, type in you forgotten to park your car. Because if we, quote unquote, caregivers, happens to us, what more for your patients who have Alzheimer's and dementia? And we need to support them. And that's the reason why we have Nikolay here, and, look, in the middle of crisis lies an opportunity. He had a crisis there. He had a crisis of forgetting stuff. Good, he didn't forget stuff today. He actually reminded me. Actually, that's good. And in the middle of crisis lies an opportunity. So whatever your crisis right now, ladies and gentlemen, if you're watching live, if you're watching on the replay, whatever situation you're going through right now, if you are taking care of a loved one that has Alzheimer's or dementia, if you're a therapist, a nurse, or whatever, caregiver, whatever crisis that you're going through, there's always an opportunity to serve. There's always an opportunity coming out of this. So again, thank you very much, Nikolay, for stepping up and leveling up, for doing this, not only for yourself, but also for your family and for the rest of the dementia population that we have. So what website can we go to, Nikolay? I mean, is there any website or email we can reach out to you?
Yes, clinicalselfie.com.
Wow, it's very, very simple. Clinicalselfie.com, CLINICAL, and then selfie, SELFIE.com.
Yeah.
Very, very straightforward. Check out that website, clinicalselfie.com. And that way you could check your current level of cognitive function. And he mentioned about those numbers, like whatever numbers that is, Nikolay. And
So, yep, sensitivity, which is correct identification of Alzheimer's in comparison to minicog, stands at 85% as of today. And specificity, which is also known as identification of no Alzheimer's disease in comparison to minicog, stands at 79%. So roughly between 79 and 85% is the good chance that it's going to give you a reliable answer for you to start tracking your memory from yours or your loved ones.
Perfect. I'm not a researcher, but I always hear that when I was studying for school, specificity and sensitivity. I don't want to say it because I get tongue-tied. Again, thank
Yeah,
you very
yes,
much, Nikolay.
exactly.
I appreciate you, brother, for coming over. If you got
Thank
any
you very much,
questions,
Dr.
just
Mike.
reach out to him. Clinicalselfie.com. And he's part of this group. He's going to continue to support us and take care of you, ladies and gentlemen. Again, thank you very much, Nikolay. I appreciate you. And
Thank you,
again,
Dr.
before I
Mike.
let
My
you go,
pleasure.
ladies and gentlemen, always remember the word fast. FAST. Letter F. Find friends that will push you to your next level because you are the average of the 5 people you hang out with. So whoever you hang out with, that's you. If you're hanging out with awesome caregivers, guess what? You're going to be an awesome caregiver. So find friends, not just friends, find association. Alzheimer's Association, find a group of people who are actually also doing what you're doing because you will learn from them. Okay. Next letter A. Letter A. There you go. Take action. Take action. Imperfect action beats perfect in action. Take action by going to clinicalselfie.com. It's going to help you. You got your baseline there, and that way you know where you're at right now. You cannot shoot a basketball if you don't know where your goal is. Same thing with taking care of Alzheimer's and dementia patients. You cannot take care of somebody else if you don't know where you're at and where you're going to. Next letter in the word fast, letter S. Letter S. Share and subscribe. Share and subscribe with Nikolay. Do you have a Facebook page, Nikolay? I guess they do, right? You do, right? Uh,
Absolutely, yes.
so, share and subscribe. It may not be applicable to you, but if you share it, it could be applicable to somebody else. It could be applicable to somebody else because when you're sharing, you're actually caring, right? And last but not the least, letter T. Not time out, but teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. Teach other people about dementia. That's the reason why you're here. Teach people about your experiences with your patients. Teach people about the experiences about your loved ones. Why? Perfect scenario. If you teach your other relative about your patient's care, for example, they don't like their blue shirt, and here comes the other caregiver coming in, and you give them their blue shirt. Guess what? They're gonna hate that. They're gonna hate you. So make sure you're teaching other people, and that's what Nikolay is here for. He's here to teach us. All right. Again, thank you very much. Any parting words, Nikolay, before I let you go, man?
No, it's such a wonderful group. I can feel enthusiasm from everyone, moderators, founders, users. It's an alive group, and it's a pleasure to be a part of it. Thank you very much, Dr. Mike.
Well, again, thank you very much, Nikolay. I appreciate you for all you do for not only for our profession, not only for yourself, but also for our profession. You keep it up. Continue to be awesome. Again, I'm going to share my screen. I'm going to play a music, and I'm going to let you go, ladies and gentlemen.